The country's first batch of COVID-19 vaccines from China, Sinovac, is expected to arrive Sunday, but the rollout will have to wait until the allocation of the 600,000 doses is firmed up, Malacañang said Thursday. We expect the Sinovac vaccines to arrive this coming Sunday, so we are all excited, said presidential spokesman Harry Roque during a press briefing aired on state television. He thanked China and Sinovac for the donation. Aside from the Sinovac shipment, 10,000 doses of a vaccine developed by Sinopharm, a Chinese state-owned company, will arrive soon, having been approved for compassionate use for President Rodrigo Duterte's security detail. Doses from AstraZeneca will arrive in March, Roque said. The delivery of the Sinovac vaccines was delayed a few days due to lack of regulatory approval. Roque touted the safety and efficacy of the Sinovac vaccine, however, saying that many world leaders have taken it. He added that the government has done everything to ensure the arrival of Western vaccine brands, including the passage of a proposed indemnity law sought by the drug manufacturers. The FDA caveats have muddled the rollout of vaccines since frontline workers in healthcare facilities were supposed to be first in line for inoculation. In a briefing, Roque said the order in which people are vaccinated has to be adjusted. For the purposes of Sinovac, the order of priority will have to be amended because, obviously, it cannot be given to healthcare workers, and it cannot be given to senior citizens. I anticipate it will be given to the armed forces and to the economic frontliners before we go to the indigents. But we are only talking of 600,000, so I think we will prioritize the military for the 100,000 and the economic frontliners for the rest. Roque explained that economic frontliners would include farmers, miners, fishermen, transport workers, and those working in export-oriented industries and business process outsourcing companies. Meanwhile, the Philippine General Hospital, or PGH, said it is ready to receive any brand of coronavirus vaccine. Whatever vaccine will arrive first, we will accept it, and our basis for receiving it is the EUA, Emergency Use Authorization, provided by our FDA, said Hospital Director Dr. Gerardo Legaspi. We all know that if the FDA gives any vaccine to EUA, the safety and efficacy are assured, he added. Legaspi said the PGH has prepared the infrastructure and logistical requirements for vaccines. The hospital director earlier reported that 94% of PGH personnel surveyed expressed willingness to get vaccinated. At the time the survey was taken, however, the hospital staff had the Pfizer vaccine in mind, since this was supposed to be the first shipment. Legaspi also allayed fears that the Sinovac jab offers little to no protection for health workers, stressing that all vaccines approved by the FDA so far, Pfizer, AstraZeneca, and Sinovac offer 100% protection against severe COVID-19. A nurses group on Thursday said a survey among their members found that while most of them are willing to receive COVID-19 vaccine, they want one that has gone through phase 3 of the clinical trials and peer review. Maristela Abenojar, president of Philippine Nurses United, said 76.5% or 494 of their 646 respondents want to be administered coronavirus shots. Abenojar said their survey did not ask which brand of vaccine the nurses prefer to receive.